Smuggled 989.
Welcome to episode 1 of 989 on Health, a show where you don't need years of university to understand the latest news about health and related subjects.
An important announcement for our listeners. This podcast is intended to be an informal tool for laymen and practitioners alike to hear our viewpoints on health and wellness. Don't rely on the information in this podcast as an alternative to medical advice from your doctor or other professional healthcare provider. For the full disclaimer, please see our website.
I'm Mike Davalos, just a guy, an average Joe. If I open a book, there better be pictures. And I'm joined by the opposite of average, Brendan Weintraub, a primary care physician. Hello, Dr. Brendan.
Hey, Mike, and I'm not a doctor. I'm a primary care physician.
Okay, what's the difference?
Well, a doctor must have completed a doctorate-level program under the education standards for the United States. A primary care physician is a licensed professional who provides health care, which includes diagnostic and treatment services, but they don't necessarily need to have completed a PhD or MD program.
Okay, that sounds like you medical to healthcare with a focus on wellness. Let's get to brass tacks here. Can you prescribe me some of that sweet oxycodone I've heard so much about?
No, I can't.
Fine. Brandon, at this point, most of your education has been in Eastern medicine, and references to that are going to keep coming up in these episodes. So setting the groundwork about the two major medical disciplines, Eastern and Western medicine, seems like an important first episode for us to have. Now, just off the top of my head, if you ask me the difference between Eastern and Western medicine, I'd say Eastern seems to be all about herbs and acupuncture needles and balancing my chi, and Western is about prescription pills, blood tests, heart surgery. So briefly, can you tell me what is Eastern medicine, what is Western medicine?
The differences between Eastern and Western medicine can be really difficult to define. Both methods of medicine definitely have similar roots. I really want to make this as useful as possible, and as short as possible. So let's simplify things by introducing the terms micro and macro. Western medicine took the path of the micro, or the microscopic. In order to find the root causes of illnesses and issues, Western medicine tries to look at the smallest possible unit and solve that as the individual problem. Let's take an example. Someone comes into a Western practitioner's office with a series of symptoms, sore throat, fever, sweats, nausea, you name it. The practitioner is going to do a number of tests and try to find the organism that's causing the issue. For our example now, let's go ahead and assume it's streptococcal bacteria, which is strep throat. That's causing the symptoms. The Western practitioner is going to try to deal with that organism.
So that's Western, and I think most of us are pretty familiar with it. What about Eastern medicine?
Eastern medicine took the path of the macroscopic. When medicine in general was initially developed, there weren't any tools to allow us to directly observe the microscopic world. The Eastern medicine took the observations that were available to them at the time and applied experiential data to create their medical system. So if the same patient we just mentioned, the one with strep throat, came into an Eastern practitioner's office, they would report their symptoms, and their practitioner would consider those symptoms along with their own observations to make a diagnosis. They aren't going to be treating the bacteria. Instead, the Eastern practitioner is going to be treating the processes of the body as a whole in an attempt to resolve the issue. So really, when we're talking about Western medicine, we're looking at multiple symptoms possibly equaling one disease process. When we're talking about an Eastern medicine perspective, we're talking about a single symptom possibly being multiple different disease processes.
When it comes to cars, there are some rare people who'll get repairs before parts break. These are usually the folks with a lot of extra time and money. But with health, even fewer people seem to make time for exercise, good food, regular checkups. You only go to the doctor when something's very seriously wrong, or you need a refill on your prescriptions, and they won't give you a refill until they see you in person. I really only know the Western medicine system, but it seems to promote the only fix what's broken approach. What little I know of the Eastern method seems more about promoting health, preventative maintenance for your body. Is there any truth in that?
I think that's a fairly apt description. Western medicine has distinct benefits, especially in the field of emergency medicine. Is your spleen about to burst? head to the hospital. Fever of 106 degrees, that needs to be brought down right now. Symptoms of a heart attack, that needs to be seen right away. However, if a patient walks into their Western doctor and says, I feel okay, I just want to make sure I stay that way, the current Western paradigm really ends up at a bit of a loss. Eastern medicine seems to have something of the opposite issue. Have you had a cough for the last 6 months and nothing can touch it? Time to see your acupuncturist. If you're feeling good and you want to stay that way, that's a great time to go see an Eastern practitioner. But the last thing a patient needs to do is go see their acupuncturist if there's an emergency situation. The methods an Eastern practitioner uses to diagnose a patient can be a little bit more finely tuned or subtle, especially for chronic issues. So if you go to see your acupuncturist weekly or bi-weekly, you can really help keep a patient's health in the best possible position.
I could be wrong, but I think that 99% of people who are feeling pretty well are not taking the time out for a wellness check, especially twice a week. It's a shame, but it's true. Just something else about our culture that probably needs to change.
Yeah, I couldn't agree more.
Now, most of the doctors I've been to are all about their chosen specialty. I've never had a doctor say, we could perform surgery and cut out the problem, or we could try some ginseng and needles. As a patient, which one would you prefer? Never had that. Now, does it have to be all or nothing, one way or the other?
It definitely doesn't have to be a black and white issue. More and more doctors on both sides are beginning to adopt strategies that involve Eastern and Western outlooks. When a physician is strongly affiliated with their own system to a detrimental degree, what we're seeing more often than not is a lack of understanding or knowledge of the available options out there. When the job at hand is to adjust a patient's overall health, it's really easy to ignore anything you don't understand or you don't have any direct experience with. Like I said, here in the US, we're definitely seeing a rise in the willingness to provide patients with both the pharmacological options and the herbal and alternative options.
Now, you could go get 2 exams, Eastern and Western, for every health concern, but almost no one has time or money for 1 exam, let alone 2. So if I have a healthcare concern, in what cases do I choose Western, or when do I choose Eastern?
Short answer, no matter what style of medicine you practice, Eastern or Western, a lifetime isn't enough time to master every aspect of human health. Doctors have specialties, if for no other reason than because at least there's a chance to master that small subsection of their field of medicine. Even when you're in a specialty, practicing means a lifelong effort to stay up to date. Ideally, every patient would have several experts on their team. They'd have their Western doctor, they'd have their acupuncturist, they'd have their other specialists, because having multiple eyes on a problem can only help resolve it more effectively. In terms of dealing with multiple appointments, in an ideal situation, your doctors from both your Eastern and Western sides would have good communication and would be able to find the best mix to solve your health issue. Whenever someone's referred from one doctor to another, there should be a transmission of information and a discussion of the case. But unfortunately nowadays that's not often the case because time can be at a premium for heavily booked practitioners. If you have multiple physicians, you as a patient have every right to make sure that they are doing the best job for you as they can. So if you feel like you're not sure who you should be seeing, talk to your doctor and see what advice they can give you.
Now, I've never had a Western doctor suggest I go to an Eastern doctor. Is the opposite also true? If I have a regurgitating heart valve, is my acupuncturist going to recommend some special tea or refer me to a cardiac surgeon?
It completely depends on the severity of the situation. Eastern practitioners are licensed and capable of treating a wider variety of conditions than you might expect. That said, if someone goes to their acupuncturist and has what we generally call a red flag condition, which really just means a symptom or set of symptoms that makes the practitioner think the situation is an emergency, your Eastern health practitioner should refer that patient out immediately for emergency care.
Now, this one isn't a question, but an example from my own life. Now, I'm no expert in this. I've had one Eastern medicine checkup in my life, but Western doctors barely talk to you these days. They see you for 5 minutes, and most of that, they're not even looking at you. They're reading what the nurse jotted down, or they're scribbling something of their own. I had a Western physical, if you can call it that, where the Western doctor never even touched me. He talked to me for 2 minutes, then sent me for blood tests. That's probably not his fault. It's a crummy financial system. He probably needs to see 50 people a day in order to pay all his bills. But the Eastern approach was all about a personalized, detailed interview. It was far more hands-on. And of the two approaches, the Eastern seemed a lot more likely to do good things for my health because I would be a lot more interested in going back to see that Eastern dude. That nice guy who saw me as a person and seemed to care about my health. Why would I go back to see the impatient Western guy? Only for refills on my prescriptions. Again, it's probably the Western system that's to blame, not the doctor, but that's how I feel.
Yes and yes. One of the reasons I personally made the decision to enter the medical world via acupuncture rather than an MD program is that the system that exists for the Western practitioner is really far from ideal in terms of patient care. After spending hundreds of thousands of dollars on education and up to 10 years between schooling, internship, fellowship, all that, most Western doctors come out of school licensed and needing to make sure they get a return on their investment. Combine that with the legal hold the pharmaceutical companies have on treatment methods and with the unfortunate state of insurance and overall healthcare costs in the U.S., and you've got a recipe for Western doctors that have just enough time to see a patient, come up with a treatment, and then get them out the door before the next patient comes in 5 minutes later. The individual doctors themselves are usually pretty competent, very knowledgeable people who just want to do their best for their patients, but time and money constraints and bureaucratic red tape just make things incredibly difficult for the Western doctor. Eastern practitioners in the States are on a similar course, unfortunately. A master's level education takes almost 4 years and $125,000 to complete. But since the Eastern paradigm hasn't come completely involved with the insurance companies yet, and because we haven't had a whole lot of legal issues in the US, generally the cost of seeing your acupuncturist is, 1, mostly paid in cash, and 2, significantly less expensive than going to see your average Western practitioner. That means that your acupuncturist overall has more time to focus on you as an individual patient.
Let's say I'm interested in what a balance of Western and Eastern have to offer, but the most important question, unfortunately, is will insurance pay for me to go see my Eastern doctor?
As I just said, for the most part, Eastern medicine is still a cash-based industry. The downside is that a visit is going to cost you more out of pocket than your copay for most insurances. The upside is potentially better care, and there's not going to be that same fear that your cost is going to go up or your insurance company isn't going to cover any more appointments or treatments. Acupuncture is becoming more integrated into the Western world day by day, and many insurance companies are actually starting to cover acupuncture treatments. So make sure to check with your insurance company and with your Eastern medical practitioner to see if there's that mesh that would allow them to cover you through your insurance.
I'm sure there's a lot of variation across the country, but how much would I expect to pay out of pocket if I have an appointment with an Eastern medical office?
The average cost of a single acupuncture appointment, at least in the area where I practice, is somewhere between $89 and $129. Each appointment is usually about 30 minutes at minimum. Without insurance, the average cost of your Western family care physician is usually about $200 and a maximum of 15 minutes. The $89 that I just mentioned doesn't actually cover herbal formulas. There are a whole slew of types of herbal medications and supplements that may be prescribed, and it's tough to put a dollar amount on the average patient. I know that for a monthly prescription of the herbal brand I use most, it's about $60. Now, the $200 that I mentioned for the Western physician doesn't cover any of the additional tests, any additional medications, etc. So I can't even really give a decent estimate of the additional costs on top of just the appointment.
I know you're hoping to open your own practice. How do you feel about the fact that you're asking people to pay more and pay out of pocket to come see you when it comes to can you get them to come and can it be sustainable?
In the long run, my goal is to try to balance out the services I feel I am able to provide with making that amount of money I have to make in order to have the practice function and be able to function in my daily life. Setting that price point is incredibly difficult. It's made a little bit easier because you have to follow what the general pricing is in the area around you. So if I were in California, my prices would have to be a lot higher just because standard of living and average cost of an appointment would be so much higher. It's kind of nice where I'm based out of. The cost comparatively is a good middle ground and allows me to potentially make a decent standard of living while being able to charge my patients what I consider a fairly reasonable amount. I can't help but look at the costs of surgeries these days and recognizing that if I can get them feeling better and their body working better, they may be able to avoid the $20,000 bill that they would have to see if they were having an emergent surgery, rather than, comparatively, $100 for a treatment is pretty reasonable.
Oh, it really is. But they don't see the surgery price in their future. It's not real to them. When I go to the Western doctor, one of the early steps in the exam is asking about the medications I'm on. So in that situation, would I need to mention any herbs my Eastern doctor has me taking? Like if I'm taking licorice, ginger, ginseng, all that stuff, just basically like food, right?
This is an absolutely critical question. My gut response is just to tell you that you absolutely need to report the use of any and all supplements and herbal medications. Licorice, just for an example, can have a really significant effect on blood pressure, especially if you as a patient are already on some form of pharmaceutical for blood pressure control. The interactions between herbs and pharmaceuticals are still poorly understood, but making your Western doctor aware of what you're on can really only help you. Unfortunately, most Western practitioners have one of two reactions when you start listing herbal medications. The first is really kind of a complete dismissal of the herbs you're taking as soon as they hear them. So many Western practitioners look at the herbal medications as harmless placebo, or at best, good for extremely minor conditions. And that's true when they're compared to what a pharmaceutical can do. But the more directed and powerful effect of a pharmaceutical drug comes at the cost of an increased risk of negative side effects. Since herbal medications, when used correctly, so infrequently have an occurrence of severe or distressing side effects, it's easy for Western practitioners to discount herbal supplements as not just safe, but potentially ineffective or inactive. That means a danger for you as a patient. The second possible reaction that I've seen is basically that the Western practitioner will, A, blame the herbal medication or the alternative treatment for the patient's condition, whatever problem they're having. And, or B, immediately label the patient with a negative opinion, which can lead to a less attentive or engaged practitioner.
Now, less attentive or engaged. You're being very careful and politically correct, but we might need to be more clear about that. Remedies can take a lot of different forms. There's folk remedies passed down in families for generations that a lot of people swear by. They might not be much better than a placebo a lot of times, but if you tell your doctor that you rub a quartz crystal on your head to treat your migraines, not only might the doctor be unreceptive to that, he might decide you're one of them new age hippies, which is wrong of them, but it can't be a good thing for how they're going to behave towards you.
That's exactly what I mean. Now, not all Western practitioners are going to react in that particular way, and as alternative therapies become more prevalent in the U.S., I think we're going to see more and more Western doctors continuing to move away from kind of these negative reactions. It's just important for you as a patient to be prepared for the possibility that you're going to run into some of these problems when you're giving your list of supplements and herbal medications. I think it's really important to mention the flip side, though. When a patient goes to see their Eastern medical practitioner, they should or will receive a very similar type of medical questionnaire from their practitioner. That means you're likely to get a very similar line of questions from your acupuncturist as you would if you went to see your Western primary care physician. So when your acupuncturist asks you about your current medications, it's important to list not just the herbal medications and supplements you're on, but also the Western pharmaceuticals. Your acupuncturist has just as much a duty to know and understand the pharmaceuticals you're on as your Western physician does to understand the herbal supplements and medications that you're on. So the unfortunate fact is that many Eastern practitioners are not as well versed in pharmacology as they should be. And that means that they run the risk of making the exact same general mistakes as your Western doctor. They're either going to ignore the pharmaceuticals as outside their understanding, or they're going to blame the pharmaceuticals too much for the condition that the patient's experiencing. Either way, it's important to mention all your medications, Eastern, Western, or otherwise, and don't ever hesitate to bring up your concerns to your physician if you don't think they're taking your medications into account properly.
There's one major factor that's probably going to keep people away from Eastern medicine. Now, this is probably just a Hollywood mistake, but I've seen in some movies, they have some, an Eastern medicine scene in them, and this one guy had like 100 needles in his face. In his face! If I got to get one needle at the Western doctor, I don't want to go. So what if I want to try Eastern medicine, but I don't want any needles to be involved?
I'm sure you won't be surprised, but this is a concern I've run into dozens of times, and I hear it every time I talk to someone about acupuncture. I think the first point I can make is that while the term acupuncture definitely has its roots in the needling process, nowadays it also refers to the wide variety of other treatment techniques that can be utilized by your acupuncturist. That means that herbal medicines, oriental medical massage, cold laser therapies, everything I've just mentioned and more can be utilized by your acupuncturist. So we're not looking at just needles. Beyond that, I think the distinction in the types of needles could be really important. When someone mentions getting a shot, or usually even just the word needle, the first thing that often comes to mind is the actions that are performed using what's called a hollow needle. And it's exactly what it sounds like. It's a solid tube of metal which is hollowed out in the center to allow medicine to be pushed in or blood to be drawn out. That's what you'll see in most U.S. doctor offices. Hollow needles basically cut out a small chunk of skin every time they're inserted. If you add to that the injection of foreign or harsh chemicals, like what would happen if you were to get a vaccination, that increases the discomfort level. By comparison, acupuncture treatments use a type of needle called filiform. And what that means is that the needle is a single solid piece of metal and very thin, and it actually works with your skin rather than cutting out a large chunk of it. What does that mean? It means that when you insert an acupuncture needle or a filiform needle, insertion is usually painless, or at least close to painless, and patients are frequently surprised by the difference.
I've definitely felt that, the acupuncture needling. I don't know, it's almost sneaky in a way, in the way they kind of tap your skin or pull it taut slightly and give you a little tap, and you don't even know the needle's in. You didn't feel it going in. It's like when someone says, I put a needle in your hand, and you picture, ow, 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 but you don't even notice it, which doesn't sound believable, I know, until you've tried it.
And that's completely true. Even I was honestly surprised when I had my first few acupuncture treatments. It's really hard to get over that sensation of fear of needles once you've gotten used to the hollow needle as your standard thought when someone mentions a needle. There are other things that I think it would be useful to discuss. Different practitioners out there have different techniques in how they needle their patients. So insertion of the needle, how much they manipulate the needle once it is inserted, how many needles are used in a single treatment. That's, of course, going to change the experience a patient has with their acupuncturist. But the details can get pretty specific, and we can probably save that for another podcast.
Research I've done so far has really shown a lot of variety in the needling, a lot more to it than just stick it in now and take it out later.
For now, I think the most important detail is that if you don't like the experience of your treatments, it's important for you as a patient to, first of all, mention what you like and what you don't like to your practitioner. Most practitioners are going to be happy to try to make the experience as pleasant and beneficial to you as they can. And then second of all, if you aren't being heard when you're talking to your practitioner about what you like and what you don't like, what works and what doesn't work, and you're finding that the practitioner doesn't meet your needs, as a patient you should never hesitate to find a different practitioner that meets your needs. And that's great advice whether you're seeing your Eastern doctor or your Western doctor. It's important to never forget that your physicians are there to help you within the range of skills that are available in their field of medicine. If you're not happy or you're worried that your concerns aren't being met, as a patient, you have the right and, frankly, the responsibility to find a physician who's going to meet your needs. So if needles are outside your comfort zone, and I still suggest going to see an acupuncturist, at least discuss the needleless possibilities with your practitioner. Beyond that, I would strongly urge you as a patient, even if you have that fear of needles, to be willing to try at least one or two to see the difference in experience between what you've got in your head and what the experience of an acupuncture treatment can really be.
People usually find a good doctor by asking friends or family. Let's say I don't know anyone to suggest an Eastern doctor. If I'm interested in trying Eastern medicine clinic in my area, how would I find a good one?
Word of mouth is going to be the best possible option available to most patients. Eastern or Western practices, if we're talking about an individual or a group, it's still woefully difficult to find reliable ratings online. There really isn't a Zagat rating or a Yelp for doctors. If you really don't know anyone who can suggest an acupuncturist for you, I would suggest going to one of the sites we'll have listed on our website. There'll be search engines directly linked to national board certification associations or similarly noteworthy organizations, which will help you find a list of licensed practitioners in your area. From there, honestly, I suggest just making an appointment with a few different practitioners. Oftentimes, acupuncture physicians will have 10 to 15 minute assessment appointments available for no charge. And new patients that are looking to find an acupuncturist can utilize that to find someone who works for their needs. So make a few appointments, go in, and if you find that you make a good connection with one of the practitioners, you like the questions they ask or the way they ask them, or maybe the way they answer your questions, and it makes you feel confident overall as this individual as a practitioner, you've found a place to start. Another possibility is to actually just ask your favorite Western medical practitioner if they have any referrals they can make. More and more Western physicians are finding acupuncturists and alternative medicine practitioners that meet their own practice style so that they can provide a consistent level of care. You might actually be surprised at how many Western doctors will have someone they can suggest as at least a place to start.
Great. Is there anything else we need to mention before we wrap it up?
I can't stress enough that any ideal health management requires physicians from both an Eastern and alternative point of view and a Western medical perspective. My training comes primarily from an Eastern standpoint, which is going to come out in the way I describe and discuss health. However, it's impossible for me to convey how important it is to use pharmaceuticals, surgery, all the tools available to Western medicine when it's appropriate for the maintenance of your health. While some of the opinions I have will definitely show a clear preference for a break from conventional Western thought, it's just as important to recognize that there are times when the alternative approach is just not adequate or appropriate. Balance is the key. There are going to be times when you need a Western physician, and there's going to be times when you need a different approach instead. The best thing you can do for yourself as a patient is to have an established relationship with physicians from across the board so that they're available to you when you need them, and so that you have some practice determining who you ought to go see and for what.
That's all the time we have for today. These are short episodes that provide a brief overview of very complex topics. Everything we say is for entertainment and educational purposes only. Licensed healthcare professionals should advise you and be aware about changes you make to any aspect of your healthcare. Every person's needs are different. The links to references we've made about news articles, medical studies, or other materials can be found at level989.com/health, along with our contact information and the complete Don't Take Medical Advice from Podcasts disclaimer. Thanks for listening, and now go health yourself.